Welcome to Fairfield Today. I'm Susan Nixon-Stoughton, your host, and today I'm with Christina Seymour-Harley, cardiovascular nurse navigator here at Fairfield Medical Center. Christina, welcome. Thank you. Today, I guess we're in the midst of Heart Month with Fairfield Medical Center, and I want to have you take us through a bit of a tour of where we are and what all happens here at Fairfield Medical Center. Welcome.
Thank you. Thank you. This is our cardiovascular diagnostic area. We do an array of tests here to try to diagnose cardiovascular disease. Oftentimes, cardiovascular disease goes on unnoticed, and one of the warning signs is a heart attack. And unfortunately, a lot of times we'll see patients who are coming in for preoperative testing, and that's when they're diagnosed with a coronary artery disease or vascular disease. Some of the tests that we do here are echocardiograms, and an echocardiogram is basically like an ultrasound like they do for babies, you know, when you're pregnant, only it's of the heart. And it's painless sound waves that bounce off of the heart and create a picture.
Well, talk to me a little bit about what if a patient comes through, and I'll go ahead and we'll take a look at one of the rooms. When a patient comes through with some heart issues, what happens? What's some of the first steps that they take? One
of the first things the doctors will do is order a stress test. Now, there's a multitude of different types of stress tests. Typically, we'll do an exercise stress test. And an exercise stress test takes two parts. We want to see the heart at rest, and we want to see the heart at exercise. So we'll hook the patient up just to EKG leads. You can see these here. And those just get stuck to the patient's chest. We'll do a series of different testing, start an IV, and then we'll have the patient get onto the treadmill. This is a treadmill right here. And we will increase their exercise.
By increasing the level on the treadmill, is that?
Yes, we'll increase the speed and we increase the incline.
Okay.
And that every couple minutes that will adjust. And what we want to do is get the patient's heart rate up to what we call a target heart rate. And at that point, when we get their heart rate up where we want that, we will inject them with a radioisotope through their IV, and then that gets circulated. And then that is taken up by the heart muscle, and then we do a scan, and then we take a look at that, how that heart muscle has taken up that MyoView, which is what we use here, the radioisotope, and it creates a picture. Now we want to compare that picture to the heart at rest. So you have the first part of the test is done with the heart at rest.
Okay.
The second part of the test is done with the heart at peak exercise. And so then we're trying to look at where does the blood flow go to the heart at peak exercise versus at rest. And if there's a blockage, that area is not going to get that circulation. And that's one of the first ways we can diagnose if you have coronary artery disease.
And is there ever a time where you have somebody in the process of being tested that the result is that they need immediate assistance?
When you do a stress test, it's definitely an indicator that there may be disease, and then we can do a more invasive test at that point, and that's a heart catheterization.
Okay. And so
the heart catheterization is a direct injection of dye that will actually go through the blood vessels, so we can actually get a picture of those vessels.
Okay.
When that dye is injected. This is much less invasive than a heart catheterization.
Okay. I think we're going to go ahead. We're going to move out into the hallway. I understand Dr. Rehan is here with us and is going to share with us some of the signs and the symptoms of early signs, I guess is a better way to put it, of some heart disease. Dr. Rehan, welcome this morning. How are you?
Thank you for having me.
No problem. Talk to me a little bit about some of the early signs that there are some issues that someone will be having with their heart.
Well, what alerts people most would be that they start having chest pain. Initially, typically that would be when they're doing some sort of an activity, they start having chest pain. And one thing that people commonly confuse is we'll ask patients, are you having any chest pains? And they would say, no, I'm not having chest pains. Because if they're getting any chest pressure or tightness, they do not call that as pain. So any chest tightness, any chest pressure, or pain that comes on with activity and is relieved with rest initially. Or if you're having a heart attack, you may start having chest pain or pressure while not doing anything and resting. This could sometimes be associated with some shortness of breath with activity. Some people, particularly diabetics, they do not get typical chest pain or pressure. They may just feel uncomfortable or start having shortness of breath only without any pain symptoms or pressure symptoms. So that should alert people towards thinking that, well, I need to be checked out for heart disease, possibly.
Can you expand on some of the risk factors that can ultimately lead to heart disease?
Definitely. We have some recognized risk factors. A couple of them are called non-modifiable risk factors that you cannot help them. Rest are modifiable risk factors. The non-modifiable risk factors would be male sex. Of course, you can't change that. Well, you can in some circumstances, but
that's another show.
yeah, there's another. But male sex, family history of heart disease, that certainly adds to your risk. And the other risk factors are cigarette smoking, diabetes mellitus, and hypertension. So these are the recognized risk factors. Other risk factors definitely include sedentary lifestyle. If you do not exercise well, you're just a potato couch or couch potato, or if you're obese, if you're overweight, that certainly adds to your risk factor. Another risk factor which is recognized is high blood cholesterol. That definitely adds to your risk for heart disease. And then there are certain novel risk factors that are more of academic interest, and we are in the process of evaluating them, that how do they impact and what treatment options can we use for them.
Sure. Talk to me a little bit about this piece of equipment that's over your shoulder, and at what point this is brought into use, and it certainly doesn't look like it's a cheap piece of equipment, let me tell you.
It definitely is not cheap. It's what we call an echocardiogram. Basically, it's an ultrasound machine which is dedicated towards evaluating the heart and the blood vessels. And with that, we throw ultrasound waves at the patient's heart. And here you see the patient's heart, which is moving. Now I'll classify this heart as definitely a little bit thickened. The walls you can see, and some calcifications around the valve area as well. This can be useful. It tells us how the patient's heart is working, how the structure is. So it will not evaluate blockages in the heart, as common people would call that, but it certainly can give us indirect evidence. If an area of the heart is not moving well, that concerns us, that why is that not moving well. And then if there are leaking valves or tight valves, we certainly can evaluate with this piece of equipment.
Perfect. Now we're going to go ahead and I'm going to have you continue through a little bit of a tour. We've seen a room. Obviously, this machine would be brought into a room, I assume, if you find out that there are some issues?
Some patients are scheduled as outpatients, and these machines are in the rooms. Patients are brought there. We put some gel on their chest wall to make it more to make the ultrasound waves penetrate easily through that. But if need be, these are mobile machines, and if the patient cannot come down, particularly inpatients, then we take them to the patient's rooms and do the procedure there. In an emergent situation, they can be rolled anywhere and done the test at the bedside.
That's fabulous. Now, we've gone through the diagnostic area of somebody coming in, maybe complaining of some chest pains. Maybe they don't even realize that's what the issue is. And some of the equipment that we've used, the problem's been diagnosed, and perhaps maybe they've been through surgery. Let's walk through this area, and then possibly we'll go up to where they would start into rehab after post-surgery.
Okay, definitely.
Let's walk through here and kind of see. You have multiple rooms, correct, where you can do the testing?
Yeah, because we get quite a patient load here. So we have about 3 exercise stress rooms or stress rooms. We have 3 treadmills. If need be, if they can't walk, then we'll administer them a medicine, which will with which we can get more or less the same information.
Okay.
So quite a few of our patients that for one reason or another cannot walk on a treadmill, we will give them what we call a pharmacological stress test, that will administer them a medicine and then get our required information from the heart. So we have 3 rooms where we can do both tests. Then we have a 4th room where we can do tests on their legs. That's another important indicator of an atherosclerotic disease process, that when people start walking, they complain of cramps in their hips, thighs, or calves. That could be a very good indicator that they have an atherosclerotic disease process. Wow. There are a lot of people that say that, well, I just have arthritis, that is why I cannot move much. But when you evaluate them, they have weak pulses, and when you evaluate them further, you realize that they do have blockages in the arteries that go to the legs. So when they walk a distance, they start having discomfort in their legs. When they stop, the discomfort slowly starts to resolve. So that is a very important indicator that you have an atherosclerotic process going on, and that you need to take care of that sooner rather than later.
With our younger viewers that are watching today, what tips would you both give to help people prevent, to even end up, to try to keep themselves from ending up in this area of the hospital? What are some good tips that you could give to help prevent heart disease?
Well, for the younger people, the most important thing is do not smoke. That's a bad habit that should be thrown to the dustbins of history.
That's good.
It was
That's
in vogue in the 60s, 50s, 60s, and 70s, but I think that should be out of the window. That's the most important intervention they can do for themselves. Rest, take care of themselves, make good exercise habits from early on, eat healthy, at least check their cholesterol early on. The primary care physicians should be alert to that so that they can get a baseline. Check their blood pressure on their yearly visits to the doctor. But once again,